Osteoporosis drugs like Fosamax or Actonel are often the first thing doctors suggest when you've been diagnosed with weak bones after menopause. But are these drugs really as effective as they're made out to be? Do these drugs actually prevent fractures, especially those hip fractures that most people should worry about? Or could they actually weaken your bones over time, making fractures more likely? And what about the side effects? Just how bad can those be? Stick around, because by the end of this video, you'll know the shocking truth about these drugs, their real risks, and why they may or may not be the solution to menopause osteoporosis that you've been led to believe. As always, this video is for your educational and informational purposes only. It's pretty obvious that you can't start taking a prescription medication without an actual prescription from a licensed physician or nurse practitioner or PA. But you'll also want to be sure to consult a licensed practitioner before you stop any prescription medication, including bone drugs. Here's a quick look at the most commonly prescribed drugs for osteoporosis, both the generic names and the brand names that are commonly used. These medications are known as bisphosphonates. They're considered the go-to therapy for osteoporosis. But just how effective are they at preventing fractures, especially those critical hip fractures? We're going to start with a major study called the Fracture Intervention Trial, or FIT. This trial showed that Fosamax, alendronate, reduced fractures in the spine, the hip, and the wrist, particularly in patients with very low bone density. In the FIT study, 3,658 women with osteoporosis were assigned to either alendronate or placebo for 3 to 4 years. The incidence of hip fractures was lower in the alendronate group compared to the placebo group. 1.1% of patients on alendronate experienced hip fractures. That's about 11 out of 1,022 patients. And 2.2% of patients on placebo fractured their hip. 22 out of 1,005 patients. That is a reduction, but the absolute difference in hip fractures between the two groups was just 1.1%. So while alendronate did decrease hip fractures, the improvement was relatively modest. Another study of 9,331 women on Actonel, the generic name is risedronate, found that 2.8% of patients taking Actonel had hip fractures, compared to 3.9% of patients on placebo who fractured a hip. So again, it's about a 1% improvement in hip fractures. Not exactly jaw-dropping, but technically it's something. A bisphosphonate called ibandronate, brand name Boniva, seems to have some ability to reduce spine fractures, but unfortunately it hasn't been very effective at reducing those hip fractures. And finally, a study on reclast, or zoledronic acid, reported a 70% reduction in spine fractures and a 41% reduction in hip fractures over 3 years. Wow, that sounds amazing. But if you dig a little deeper into the data, the actual numbers are a bit less impressive. 2.5% of placebo patients had hip fractures, and less, 1.5% of reclass patients had hip fractures, which is an absolute risk reduction of 1%. Meh. So yeah, bisphosphonates can reduce fractures, but their real-world impact, especially for hip fractures, is often far smaller than you might hope. In a previous video, I told a heartbreaking story about my mother-in-law, Catherine. Well, Catherine was healthy enough to live to a ripe old age of 101, but Catherine struggled with severe osteoporosis that led her to have a broken wrist, not one but 2 hip fractures. She also had spinal compression fractures that caused a lot of chronic pain for decades. Catherine's menopause osteoporosis eventually took away her ability to walk, as well as her independence. Osteoporosis put her in a wheelchair, in a nursing home, all the way up to the end of her life. What I didn't mention in my previous video is that Catherine was on alendronate, or Fosamax, for, I don't know, maybe a decade, maybe 15 years. It's a little hard to reconstruct exactly how long she took it in retrospect. Fosamax just wasn't all that helpful. It might have been too little, too late, it's hard to know. Bisphosphonates are also notorious for their side effects. GI issues, primarily associated with oral bisphosphonates, include esophagitis, esophageal ulcers, gastric or stomach ulcers. Some people get musculoskeletal pain, bone pain, joint pain, muscle pain. Sometimes that can be severe. Flu-like symptoms are more common with intravenous or IV bisphosphonates, fever, muscle pains, joint pains. One side effect seems to be the biggest deal breaker for patients. There was a study funded by the manufacturer of Fosamax, Merck, to look at the side effects for alendronate. Merck's own study of 75,000 women showed that a staggering 60% of patients quit taking alendronate within a year. Why did they stop taking it? Because of side effects like gastric reflux and esophagitis. Lots of patients have had serious, even life-threatening issues with esophagitis because of bisphosphonates. There's actually an extremely specific protocol for taking bisphosphonates that's all about preventing this serious esophagitis from happening. You're supposed to take the tablet first thing in the morning with a full glass of water. You need to stay upright for at least 30 minutes and you can't lie down. You're not allowed to take it with any other medication or supplement or coffee or food. But even with these precautions, the side effects lead a lot of women, as I said, 60% in one study, to stop that treatment early. Long-term risks, though, is where things get even more concerning. If you take bisphosphonates for more than, let's say, 5 to 8 years, your bones can develop what are called microcracks. Those are cracks in the bone that are hard for the body to repair. These microcracks can lead to atypical fractures. You can break your hip while simply standing there minding your own business, doing the dishes. Atypical fractures are a little different than the usual fractures that are caused by the osteoporosis of the hip, and they can be a lot harder for doctors to repair. Osteonecrosis of the jaw is a rare but devastating condition that causes the bones in your jaw to sort of break down. Often it's tied in with dental work where the dentist is trying to get some teeth to settle into your jaw. This is a problem that's excruciating and disfiguring, and it often takes years of treatment to manage. Well, I personally know somebody who experienced osteonecrosis of the jaw. It wasn't related to bisphosphonates, but it was absolutely heartbreaking. This woman endured severe disfigurement. She couldn't eat anything for months. She suffered through several painful, agonizing surgeries. She's a lot better now, but it's been 3, maybe 4 years. Well, both of these risks, atypical hip fractures and osteonecrosis of the jaw, are rare, but they're also extremely serious, especially if you've been on bisphosphonates for 8 to 10 years or more. Well, published guidelines recommend limiting bisphosphonate use to up to 10 years for oral formulations and up to 6 years for IV or intravenous formulations. After that, doctors need to assess whether the patient still needs the therapy or she can take what's called a drug holiday, basically taking a break from the medication to reduce the long-term risks. But here's the challenge. When you lose estradiol at menopause, you also start losing bone density. It's at about 1.67% per year, according to one study. If you're in menopause at age 51, let's say, and you live to 85, that's 34 years of bone loss, unless you take action. The catch-22 here is if you take bisphosphonates for too long, you could face some pretty severe long-term risks. They're rare, but also bad. Or stop taking them, and you start losing bone almost immediately. But there is one treatment for menopause osteoporosis that addresses the root cause, the loss of your hormones. This treatment is safer and more effective for wrist, spine, and hip fractures than bisphosphonates are over the long term. Click here to watch my next video where I'll share the most powerful osteoporosis strategy for postmenopausal women, one that has minimal side effects and keeps your bones strong for decades.